Hello, I am Haley Bailey. I am one of the freshman nursing instructors here at East Mississippi Community College. Today, I'm going to be demonstrating to you the process of tracheostomy suctioning. Can we start over for just a second?
Yeah, you can just keep going. I'll just cut it out.
I want to make sure it's turned on before we get, because that would be my look. Okay. Hello, my name is Haley Bailey. I am a freshman ADN instructor here at East Mississippi Community College. Today, I'm going to demonstrate how we suction a tracheostomy tube. Before we do that, I am lucky to have a volunteer with me. Here at East Mississippi Community College, we have some really cool technology to help us with the process. As you can see, she is wearing this strap-on chest. This is from Avkin and it's a simulation model, and it's going to actually allow our students to suction mucus and secretions out of the tracheostomy tube. I can also control the sounds of what they hear whenever they auscultate the lung sounds. So through an app on my phone, I can change her lung sounds, and our students can better assess lungs and have an idea of what it's like in the real world. So here at EMCC, we like to have. How many other people messed up on this?
It's all right. Just start back over and you'll.
All right.
You're doing good.
Hello, my name is Haley Bailey, and I am an associate degree nursing instructor here at East Mississippi Community College. Today, I'm going to show you how we suction tracheostomy tubes. Here I have a volunteer with me, and she is wearing some of our newer technology to the clinical area. This is an Avkin device where I am actually going to be able to suction real secretions out and as well as mucus. Something really cool about this as well is I can change the lung sounds for my students so my students can better listen to what real lung sounds sound like, and I can alter those as well. So we're really excited to have this at EMCC and better prepare our students for the clinical field. So before we get started, I'm going to tell you a little bit about what a tracheostomy tube is. Basically, this is just an artificial airway that's been created by a surgeon to bypass the upper airway. So for whatever reason, our patient here is no longer able to breathe in and out of her nose and her mouth. So we've had to have this artificial airway created so she can continue to breathe. So this is the way she breathes, and she also is able to cough through this as well. One downside to the tracheostomy tube is, unfortunately, our patients will not be able to communicate with us. When we speak off of expirations, off of breaths. So she doesn't have that ability to use anymore. So she's going to have to communicate with me in different ways, and I'm going to have to take note of that as well. So before we get started, there's a couple of things that I need to do. For one, I need to check my physician's orders, and then I need to check it against her armband. I want to make sure that I have the correct patient before I perform my procedure. Okay. Next, I'm going to check baseline vital signs. After we finish with the procedure, I'm going to get another set of those vital signs so I can compare and make sure she tolerated the procedure well. So if she has a decrease in her oxygenation after the procedure, I know that she probably did not tolerate this as well. We're also going to listen to her lung sounds with a stethoscope before and after so we can compare and see how she did with the procedure. I'm also going to make sure that I educate her, and we're going to say Miss Howard here is very familiar with having her tracheostomy suctioned. A lot of these patients have these permanently, so she is aware of how we're going to suction. So otherwise, I would educate her on what we're going to do today. So also, I want to make sure, Miss Howard, in case you feel uncomfortable whenever I suction you, will you please just tap me on my arm? That way I can stop. Because remember, she's not able to communicate with me, so I need to provide a way of communication. All right, so we're going to get started and we're going to make sure that we have gathered our supplies. You need a suction device with a suction canister. I have already set up my suction tubing here. I need a drape that I will drape across her chest because we are dealing with secretions here. We want to keep everything clean. And I'm also going to provide some protection for myself. So I'm going to put a gown on. I would also put on goggles, but for demonstration purposes, we will not do that today. So protecting myself from any secretions. Okay. We will also need some sterile saline. And then we will need the suction catheter kit. The process of suctioning a trach is actually pretty simple and it's pretty quick. But what makes it a little tricky or a little difficult is it has to be a sterile procedure. So we have access to her lower airway. I'm actually going to be inserting a catheter pretty deep into that airway. And this is an area that we don't need to get any microbes like bacteria or viruses that could make her very sick, and she could have pneumonia from that. So this is a sterile procedure. Our items that we'll be using today are specially packaged and that they don't have any microorganisms on them. But I'm going to have to be very careful whenever I am suctioning. I don't want to brush up against any of the items that are already out because that would contaminate the suction procedure, and I could actually introduce some microorganisms into her lower airway. So we have to be very careful with sterile procedure. All right, so I'm going to go ahead and turn my suction on in preparation. We're going to open up our suction kit very carefully. I'm going to get out this little box, and I can actually touch this, but I cannot touch the inside because that is where my sterile solution is going to go. And again, I do not want to contaminate my patient. I'm going to go ahead and pour my sterile solution. Okay. And now we're going to glove up.